Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Stages. Stage 1A, grade 1 and grade 2. So if the patient is in stage 1A, grade 1 and grade 2, then you can do total abdominal hysterectomy and bilateral salpingo-oophorectomy. If the lymph node involvement is less than 2 centimeters, then nothing. If the tumor involvement is less than 2 centimeters, no lymph node dissection is done. If the tumor involvement is more than 2 centimeters, then lymph node dissection is done. Nothing is to be done. If it is more than 2 centimeters, then pelvic lymph node dissection is done. Post-operative therapy is not needed. If it is stage 1A and grade 3, in stage 1A and grade 3, we do total abdominal hysterectomy with bilateral salpingo-oophorectomy. This is done along with pelvic and para-aortic lymph nodes, and post-operatively radiotherapy is given. In stage 1, stage B, stage 1B. In stage 1B, we do total abdominal hysterectomy with bilateral salpingo-oophorectomy, and pelvic and para-aortic lymph node dissection is done. Post-operatively, radiotherapy is given. Stage 2. In stage 2, we do Warthin's hysterectomy is done, and pelvic and para-aortic lymph node dissection followed by radiotherapy is given post-operatively. In stage 3 and stage 4, debulking surgery is done, and lymph node if there is para-aortic and pelvic and para-aortic lymph node dissection is done. Post-operatively, chemotherapy is given with or without radiotherapy.
thank you and thank you for watching.